Hi, welcome back. In this video, we will understand breastfeeding in cleft lip and cleft palate babies. So babies with cleft lip and cleft palate have a defect in their lip and the palate because of failure of fusion of the palate and the lip. So it can be a problem of the lips or at the palate or both. If it is detected early, the mother can be motivated before the baby's delivery. And why it is difficult in these babies to feed and what are the solutions? These are the points that we will see in this presentation. So cleft lip can be or cleft palate can be a complete one where the defect will start from the mouth and then enter into the nose cavity. It can be a unilateral cleft lip which involves only the lip, or a bilateral cleft lip which involves both the lips, or a unilateral cleft lip and palate which involves the palate also, or a bilateral cleft lip and palate. Sometimes it can be confined to only the back portion of the palate, which is the posterior cleft palate. And the lips are formed at around 4th and 5th, 7th week of the embryo, and it is formed from the 5th pharyngeal arch, that is a structure in the embryo, the fetus. And the palate is formed at the 6th and between the 6th and the 9th week, and both the structure joins in the center. In India, the incidence of cleft palate is around 1.3 per thousand. That means approximately 1 per thousand live birth. And 78 babies are born every day in India with cleft lip and cleft palate. And it is higher in southern states due to the blood relation between mother and father, which is called consanguinity. So the causes can be genetic or because of smoking in the mother, or diabetes before pregnancy, or the use of anti-epileptic seizure medicines like topiramate and valproate in the first trimester of the pregnancy. So in babies with cleft palate, if they end up in formula feeding, they may have more infections. That is why we want to promote more breastfeeding in these babies. And breastfeeding also will help in the face and jaw development as per studies. After surgery also, the breast milk contains the epithelial growth factor and the enzyme which stops the wound from getting infected. And many babies are allowed to breastfeed straight after surgery. Can it be diagnosed before delivery? Yes, by an expert in ultrasound. After delivery, by directly seeing the palate or by inserting a gloved finger into the mouth of the baby. There is something called submucous cleft palate which may be difficult to see and therefore diagnose. And this submucous cleft palate is a cleft in the palate, but it is submucous. It cannot be seen. And such babies may have a bifid uvula. Uvula is a structure in the throat, and it can be bifid. That means it may be split at the center. So at 4 months of age, these babies can be treated with a lip construction at 4 months, followed by at 10 to 18 months, that is at around 1 year or 1.5 years, the palate is also corrected. Meanwhile, while feeding, the babies can have regurgitation of milk through the nose because the oral cavity, the mouth and the nose is connected through the palate. So these babies may be fed in a 45-degree position or an upright position. So place your baby in an upright or sitting position to prevent the milk from flowing into the nose area. Then these babies may also swallow a lot of air because the mouth is connected with the nasal cavity. So they can their stomach may get full with the air, and they may have vomiting, and even the milk can go into the lungs. So these babies need to be burped, or the air need to be removed at least 2 times during the feeding and at least once at the end of the feeding. So babies with a cleft need to be burped more often because they take in more air while feeding. And watch for signs of discomfort. Your baby will give you sign when it's time to stop and burp. So how to breastfeed or feed? So babies with cleft palate, you can close the cleft palate with the breast tissue. So babies of cleft palate may have difficulty in creating suction, as the oral cavity cannot be separated from the nasal cavity, so that they cannot draw in milk actively from the breast. So the milk may have to be pumped or expressed by hand or pumping, and then give by spoon feeding. So feeding in the semi-upright position is done so that the milk does not regurgitate through the nose. And the head, neck, shoulder should be in one line. And these babies may need special feeding bottle like the Haberman or the Mead Johnson cleft palate bottle. The cleft palate may cause ineffective feeding, low blood sugar, and poor weight gain. Cleft lip, however, in babies with only cleft lip and no cleft palate, breastfeeding is not a problem. Even a submucous cleft may cause feeding problem. Still, we can try breastfeeding in these babies. Why it is important to breastfeed? Because when the baby suckles at the breast, she will exercise her facial muscles, and the breastfeeding also helps in bonding between the baby and the mother. And the breastfeeding gives baby a lot of cuddling and skin contact and helps mother to get to know her baby more. And babies with a cleft also often need extra care. And if the cleft is unilateral, that is only in one side, then the breastfeeding can be done with a nipple directed to the side that has no cleft. And while feeding, the mother can compress the breast, synchronizing with the baby's suckling. So she can simultaneously squeeze the breast to increase the flow of the milk with the baby suckling. And it has to be done gently. Sometimes these babies may not swallow fast, and the baby can accumulate in the milk and baby may have choking. So it has to be done very gently. If there is no drooling of milk from mouth, then stop and restart feeding after the baby has swallowed. Sorry, if there is drooling of milk from the mouth, that means the mouth is full and the mother has to stop and restart the feeding after the baby has swallowed. To help form a seal and keep suction, hold the breast in the baby's mouth by pressing with the index and the middle finger on the breast well back from the nipple, making the breast protrude as if full of milk. And comfort, sucking and feeding to sleep are important for baby for both food, feeding, sleeping, and learning. Now, babies with a bifid uvula and submucous cleft palate. Now, patient with a baby with a bifid uvula have problem moving their soft palate while eating and drinking. And submucous cleft palate babies may be having associated bifid uvula. And midline palatal muscle diastasis may be there with the intact mucosa, and notching defect in the posterior hard palate may be seen. So, in any case, the bifid uvula rule out a submucous cleft palate. So this is the bifid uvula. As the baby grows, the uvula also grows. And for feeding, the mother may have to express the milk, wash her hands, and sterilize the container by washing the container in a soap water and then warm water, and then submerging the container in 15 minutes of boiled water before each use, and then express the milk and give by spoon. So there are different feeding devices, like the Rose feeding device, then asepto is feeding device, then the special nipple, and then pigeon nipple is there for cleft palate, and there are nipple shape recommended for bottle feeding in cleft babies. And this is a special needs feeder, which was originally called the Haberman feeding bottle. So the special needs feeder will have a long teat which can be inserted into the baby's mouth. Now, this teat is used to the mother can gently squeeze the milk into the baby's mouth. The flexible part of the valve, the third part, is there, and then there is a a ring to keep the teeth and the valve on the top of the bottle, and then there is a standard sized bottle. Now, if the special needs feeder is not available, then you can make a X-shaped cut on the regular nipple and feed the baby with the bottle. And you have to sterilize the bottle before each use. So, while using special needs feeder, keep the bottle tilted so that the nipple is always filled with milk and pointed down away from the cleft. You should only squeeze when the baby is sucking, and watch your baby closely and listen for swallowing sounds. If your baby pauses to breathe, then you should also pause. If your baby is getting milk out of the bottle, you should see air bubbles in the milk. If you forget to stop squeezing the bottle when your baby pauses, your baby may cough and sputter. And just take the nipple out of the baby's mouth for a moment and let them settle, then continue feeding. Palatal obturator. Now, obturator is a dental plate. Palatal obturator is a dental plate which can be used from the early days after birth. It has shown to improve breastfeeding in full-term babies with a cleft palate. Their careful attention should be done to positioning and attachment. And as your baby learns to take the nipple well into his mouth and press it against the palate. Some mothers have found a plate, that is the palatal obturator, more difficult to breastfeed. So it is best to keep an open mind and work out what your baby needs. This is a palatal obturator. The mother may choose the spoon feeding or palatal feeding and sometimes bottle feeding. She needs to learn to feed in an optimum way, that is, position the baby at 45-degree upright while trying direct breastfeeding baby's cleft palate. If the baby is having only cleft lip, then position so that the cleft lip is oriented towards the tip of the breast, and they feed best with a cross cradle or a football position. So you know the cross cradle and football position. You support the neck with the opposite hand in cross cradle or the same side hand in football position. The mother can occlude the cleft lip with thumb and support the baby's cheek to generate effective suction. But she should wash her hand with soap and water before doing that. If it is a cleft palate, as we have already seen, feed the baby semi-upright 45-degree to reduce nasal regurgitation. The mother can use football position and position the breast towards the greater segment at the side of the palate that has the intact wall, which does not have the cleft. Chances of failure is highest with the cleft lip and cleft palate. So deliver the milk to baby's mouth using spoon or bottle. Now, if the cleft palate is there, the breastfeeding may succeed. Sometimes use a small soft nipple with large opening can be done. If it is a cleft of the soft palate only, then the breastfeeding works. And if the cleft is only at the lips, then also the breastfeeding will work. So thank you for your patient listening. Hope you understood how to give breastfeeding for babies with cleft lip